Tonight we're going to be talking about toe walking. I'm just going to start talking a little bit about it, and I might repeat this for the others who are joining us. You might be curious about toe walking. It might be something that your child does, or something you want to learn more about to make sure that your child is meeting their developmental milestones. But in general, toe walking is not something, Megan, you can stop the screen share right now, and then we'll restart it in a minute. Thank you.
Mm-hmm.
So in general, toe walking is not something your child will just grow out of. And if you're leaving it unaddressed, it can affect their ability to meet their important developmental milestones. So that's one of the reasons that we're holding this webinar tonight, to teach you more about what is proper gait, what's a gait abnormality, and what can be done to correct it if you're a child or grandchild, or if you're a provider or educator, one of the children you serve might be demonstrating some of these symptoms. It's important for them to meet their motor milestones so that they're creating a strong foundation for growth as they get older. And we're glad to have you all here tonight. Hi, Elena. Good to see you. Elena is from the ARC of Snohomish County. They provide advocacy. Hi. They provide education and advocacy for families of children with special needs. So good to see you. And we did a partner presentation with her a couple of months ago. Sensory processing. Was it sensory processing? Was that our topic?
Meltdowns, I think.
Meltdowns, right, which is related to sensory processing. So good to see you. I'm glad you could
See you.
join us here tonight. And for those of you continuing to join us, you're welcome to put in the chat where you're joining us from tonight. It's kind of nice that we can do these webinars and serve people from a broad range of locations and shoreline. Thank you, Bree. And I'm in Bothell, and it's nice that we can see people from all over because we serve clients all over Washington State. Snohomish and Marysville as well. Great. Kenmore, thank you. Very good. Well, I'll start. My name is Diana. I am the marketing coordinator at Bothell Pediatric and Hand Therapy. We have been an independently owned clinic in Bothell for 18 years. We actually have two clinics. One is a hand clinic, which is rehabilitation for adults and children when they are dealing with accident or injury recovery, including repetitive stress injuries. And then we also have a pediatric center where we offer occupational therapy, speech therapy, and physical therapy for children with autism, children with developmental delays, and children with disabilities as well. And I'm just going to do a little bit more of an introduction because I think we have a few more people joining us tonight. But tonight we're going to be talking about toe walking, and we've got with us our two doctors of physical therapy who work at the Pediatric Center. We've got Dr. Becky Rousseau. Raise your hand, Becky. And then we've got Meghan Patton, and they are going to be presenting tonight on toe walking. So we will cover early walking milestones to keep an eye on. What's a normal gait pattern versus toe walking? What are some various causes of toe walking? What should you look for? When is it normal or abnormal? What are some of its correlations with other developmental delays? And talk a little bit about the importance of early intervention and what can be done to treat children who are toe walking, when to seek treatment, and how it can help them work towards those important developmental milestones so they can create a strong foundation as they grow. So, without further ado, why don't we go ahead and get started? So Megan, you can go ahead and start the presentation, And if anyone has questions as we're going along, you're welcome to put those in the chat, and we will do our best to get those answered for you. Thanks for joining us tonight.
All right, so as Diana kind of gave us our intro, this is Toe Walking Explained. I'm Meghan Patton. This is Becky. We're the licensed physical therapist giving the presentation today. The beautiful thing about learning is no one can take it away from you. So anything that you can take away from this presentation, we hope can help you with your kid or a kid that you're dealing with or anything along the lines of that. So we're going to start with what is toe walking. Toe walking is a pattern of walking where somebody kind of walks on their tiptoes all the time. It's not what you would normally see walking around, like an adult walking around. And this isn't sometimes when kids are trying to be sneaky. It's they're walking on their toes all the time. So you don't see their heels touch the ground. What causes toe walking? There are a variety of different causes for toe walking: cerebral palsy, muscular dystrophy, autism, sensory processing disorder. There's also a couple more in there that aren't just as common, or it can be idiopathic. So some kids can be diagnosed with idiopathic toe walking, and that's about 1 in 20 children will actually be diagnosed with it. So they don't have these other diagnoses listed, but their parents, their doctor, their teacher, whoever has noticed that they're walking on their toes consistently enough that it warrants a physician referral for idiopathic toe walking.
Can you explain what idiopathic means?
Yep. So sometimes there's no direct cause of toe walking. Like I said, it'll be idiopathic. So a friendly definition of it is arising spontaneously or from an obscure unknown cause particular to the individual. Basically, it means there's not a set reason why these kids are toe walking. They just started to do it. So they can't pin down one thing that's causing it, but they are doing it. And so that's why it's kind of idiopathic. It comes out of nowhere. The good thing, though, is just because there isn't a determined cause doesn't mean that there isn't a way to treat it. We treat a lot of idiopathic toe walking.
So, signs of toe walking. Your child may have difficulty putting on their shoes. It could be difficulty putting them all the way on, or they don't like wearing shoes at all. If your child is bouncing as they walk, so that could be up and down with each step as they walk, or intermittently bouncing every couple steps. They can't balance standing still, so they have a very difficult time standing in one place without taking small steps, and kind of that bouncing goes with that. They're very clumsy, fall down more than their same age peers. So you will, toddlers, they fall down a lot, but is it more than someone else in their preschool or daycare? They have abnormal shoe wear. So is the toe portion of their shoe wearing out faster than their heel, or their heel isn't wearing out at all and it's just that toe portion? They have trouble running. So are they hesitant or delayed in running, or delayed or hesitant taking those stairs? They have funny toes or foot shape. So their toes might be spread out really far out, and it might look like they're trying to grip the floor and widen their base of support. And the last sign that we listed here was that they're complaining of pain in their feet. Could be their foot, their ankle, or even knee pain. So all those signs previously listed are atypical for normal development, but it doesn't necessarily indicate toe walking. But if your child has 2 or more of these signs, it would be best to be evaluated by a pediatric PT. And just because we evaluate does not mean that they need PT, but it's good to find out if this is truly toe walking and what you can do about it if it is.
Or if they have some of these signs, and like we said, it might not be toe walking, it could be something else with it, which is also worth investigating.
And so what isn't toe walking? If your child only takes a few steps on their tiptoes, but then returns to their flat feet, and it only happens very intermittently, has only just begun learning how to walk. So children younger than 2 years of age may intermittently walk on their toes, which is normal, but prolonged periods of that tiptoe walking, especially past the age of 2, is considered toe walking. Is only walking on their tiptoes when being sneaky or silly on purpose, like Meghan mentioned earlier, or if they're just reaching for something high up, like this picture, just trying to get those cookies or the puzzle or any of those toys up on a higher surface, then your child is most likely not a toe walker. So we have a huge sensory component with toe walking. More and more, we're having more of those ASD diagnoses and sensory processing disorders. So we're seeing more and more toe walking with a sensory origin than we have ever before. And toe walking really used to be a muscle tightness issue or neuromuscular issue, and more kids are coming in with that sensory origin. So vision, vestibular, and proprioception may all contribute when looking at a kiddo who's toe walking with that sensory origin. And with vision, vision is your ability to see your surroundings. So that contributes to balance. And as a PT, we can see that it might be partially vision and refer out to the proper physician to look further into that if that's one of the reasons. Vestibular, that's dizziness and sense of upright position. That contributes to postural control and balance, greatly affecting their toe walking possibility. Proprioception is where you feel your body is in space. So that contributes to postural control and balance. So those who are clumsy or fall a lot or have a hard time understanding where their body is, that might be one of those big hitters there is their proprioception and why they're toe walking. And lastly, tactile is how much you're physically feeling and if those sensations are pleasant to you. So a lot of kiddos either do not like the sensation on their feet, or there's a misperception of that sensation on their feet, such as feeling the carpet as painful. So they're going up onto their toes because it hurts them, and they're having that misperception within their sensory system of what they're feeling at the bottom of their feet. So what else can be connected to toe walking? So many children that toe walk also end up having a speech or cognitive delay. That gives us as PTs, who are usually the first people to see these kiddos, especially if we are seeing them earlier on, before we notice that speech or cognitive delay, because the speech and cognitive delays haven't been assessed yet or noticed yet because they're so young and they haven't had that speech develop, or the cognitive testing hasn't happened yet because they're so young. So that gives us a cue to look for those and refer to the speech language pathologist or OT or their physician for more cognitive testing. Drug exposure in utero sometimes causes an extensor pattern. So they are toe walking up on their toes because their whole body is extending back. GI distress, due to the discomfort, they end up having that extensor pattern. And this we would be able to figure out during evaluation if that is what we're noticing and do a direct referral out to the person most appropriate for that GI distress causing the toe walking. Low birth weight, prematurity, weakness are all have been connected to toe walking in research. And using an exerciser and other things of the like in this picture. So exercisers, they create poor posture, abnormal position of the pelvis, and allow for the child to push up on their toes and walk on their toes, creating that extensor motor pattern that becomes a norm to them. As well as if they end up using it too much, they may cause tightness in their calves. And so now we have a muscular origin that's causing that tightness, and now they can't go down on their heels without feeling that tightness and stretch, and they don't like it, and so they're going to stay on their toes. And another thing not listed on your slide would be the bumbo seats. A lot of young children, parents like to place them in there because they just need to put them somewhere for a minute. But prolonged use of bumbo seats create poor posture, creating that weak core, and a weak core can contribute to toe walking. So those are just a few other things that are connected to toe walking.
So I'm going to talk a little bit about the development of normal walking. So when kids start to walk, generally around anywhere from like 9 to 14 months of age, 12 being the happy medium there, they kind of look like they're a little bit wobbly. They have wide legs, their arms are held up, and they're kind of marching. They're not taking really far steps, but they're taking little steps with their feet kind of side by side. Initially, when they start walking, if they go up in their toes, that's not totally abnormal, but they should kind of have flat foot contact because that's the most stable base of support that they can have. And especially when they're just kind of figuring how to walk, that they want to be as stable as possible because babies fall down a lot, but they don't actually want to fall down. So we call it a stepping pattern, like I'm talking about, where they're taking small steps, high knees, kind of flat foot contact. And then as they get older, towards the age of 3, they mature and they actually take adult-like steps. So they'll begin to take longer steps. Their arms will relax down. It'll be a narrow step width. They'll go from heel contact to midfoot and they'll push off through their toe, like you should see an adult walking around. So between 1 year and 3 years is really where we see it change from kind of stepping to mature gait is what we call it. Anytime that somebody or a child is walking for more than 6 months on their toes, that's really when we would feel that's toe walking because it's prolonged, which is, I kind of got a little bit of my head of myself here. But like I was saying, any more than 6 months, they'd be classified as a toe walker and a PT evaluation is warranted. A lot of people say if they're not walking normal by 3, but really 6 months or longer at any age once they're walking is considered atypical. And the sooner you get them into PT and we could potentially have an intervention for that, the more effective it's going to be because the younger they are, the more responsive they are to kind of therapeutic intervention. Long-term effects of untreated toe walking. So if we don't get to see them sooner and it's later and later and they've been walking on their toes longer and longer, you have shortened calf musculature. So their calves get really, really tight because they're up on their toes the whole time. They can have bony changes in their feet. So if you guys can see this picture of the x-ray I have, because they're up on their toes all the time and they don't have that flat foot contact, it's not like a stable base. So their toes spread out to almost like grip the floor and give them like a wider point of contact, but the bones will spread with them too. So that's causing bony changes, which makes it even more difficult to get into shoes and also is going to cause pain and like arthritis later. They have poor balance because they're really only up on their tiptoes. I mean, if you tell anybody to stand up on your tiptoes, you can't really do it for that long. So they have poor balance all the time because they're always there. They have delays and impairments in motor milestones. So we're talking about running, like we were talking about earlier, jumping, getting participate in sports. Because they have this poor balance and they don't have that mature gait pattern, they're not able to get those experiences of improving kind of like their motor milestones. They have an altered sense of their legs. So imagine if you're on your toes all the time and your knees mostly are straight, your legs feel very different under you and you feel very different if you try to put them in different positions. So if you're so used to being in one position for so long, you're going to have an altered sense of what's below you. It can lead to chronic foot, knee, hip, and back pain. So like we said, if you're up on your toes all the time, that impacts your toes, your ankle, your knee joint, your hips, and your back. And it's going to put a stretch or kind of a tautness on that whole muscle chain. So it can lead to bony changes throughout, and it can cause that kind of chronic pain. They have decreased overall range of motion. So like I said, if it causes that tightness in the muscles, you're going to get a limit in those joints and you have that altered sense of your legs. So you don't want to put it in a position that it's not used to. So it's going to further restrict that joint range of motion. They have a decreased strength of legs in their abs. So if you only use your legs up on your toes, kind of in that straight position, you're only getting a little bit of the range that the muscle is allowed to do. And since you can't go running or jumping, you don't get that strength building experience. So your muscles really aren't put to as much use as they can get. And so they get weak over time and they don't get to their full strength. And your core holds everything together. So if your core has to follow what your legs are doing, it's also not going to be that strong because it's only used to being in this position and it doesn't get that experience of kind of moving around. They have a higher risk of frequent injuries of the ankles and the knees. So like I said, you're up like that, your ankle's pretty vulnerable. I don't know about you guys, but I roll my ankles all the time. So imagine if you're up on your toes like that, it's not a stable position. As soon as you try to turn, you can roll your ankle and your knee goes with it. They have poor endurance. So because they're not running and they're not getting those motor milestones or building that strength, they can't build up their ability to keep up with their peers. So they're going to get tired pretty quickly. It's not an efficient way of walking, and it's not a super safe way of walking. So their body doesn't have the ability to build up the endurance to do the things that they want to do. And they have difficulty participating in daily activities because they're kind of stuck in this pattern. I mean, you can't go play soccer with your friends, or maybe riding a bike is difficult, or, you know, climbing on the jungle gym because they can't get their foot into that like little rock to get up the playground. So it has a lot of long-term effects. And the goal, especially with PT, is addressing all these things and getting the kid to get the most out of life and to participate as much as they can. So to sum up toe walking, there could be a lot of different reasons a child toe walks, and toe walking consistently or past the age of 2 is atypical and can lead to unfortunate long-term effects. So there's a bunch of reasons, but the good news is PT is pretty good at finding these and addressing these. So I bring you to the next slide.
So physical therapy and toe walking. PTs are trained to evaluate the entire patient. We are trained to narrow down the potential causes and impairments of your child, like we discussed earlier, to develop the individualized treatment plan best suited to address your child's toe walking. We like to evaluate the child and place them in 3 treatment categories of either sensory, neuromotor, or musculoskeletal. That is a research-proven technique, and within those 3 categories, we have a set of possibilities of treatment options that then the therapist is able to deduce even farther down for what's an individual, for what that child was evaluated and noted on with their impairments. So some of the potential treatment possibilities is strengthening sensory integration. That's the big one for the sensory kiddos. Stretching, orthotics, balance training, gait training, providing the family a home exercise program, kinesiotaping, reflex integration, electrical stimulation, and manual techniques. And these are all very specific, what the strengthening and stretching is to each kid, what that sensory integration is for each kid, depending on if, you know, they're looking at more proprioception or vestibular, et cetera, of what those are, and where they are within their milestones, and what they're presenting with difficulties and impairments with. So like Megan had began talking about earlier, was that toe walking affects those gross motor milestones due to the instability, the bony abnormalities, the pain. They're not able to reach some of their gross motor milestones. So some of those may be balance tasks, such as single leg balance or on a balance beam like this. Very difficult when you're up on your toes. It's like Olympic gymnasts do. So it's really hard if that's what they have to do every day on the playground. Kicking, running, jumping, stairs, even transferring from floor to stand is really hard without that stable base, and having difficulty participating in recreational sports or PE with their peers because of that decreased endurance, abnormal gait pattern. They're just not able to participate at the same level.
So we as physical therapists these are some basic goals: providing that stability at their ankles or at their core for their balance, improve their walking pattern, making it more efficient movements. They can build up that endurance and they can get that range of motion and they can do all those things, preventing those long-term effects. So preventing those bony changes or there's constriction to range of movements. And sometimes, depending, we can refer to specialists like OT, orthotists, neurologists, and vision specialists. If part of the reason they're toe walking is kind of out of our scope, we know the right person to do it. The thing with physical therapy is we're giving you these general treatment ideas and these general goal ideas, but for every kid that walks in, it's different. Even if there are two sensory kids, the way that they respond to the therapeutic interventions is different. So our plan and our goals for them are going to be cued towards that kiddo specifically. So there might be some strengthening and sensory, and there might be more vestibular and core. It just really depends on the kid. And that's the best part of what we get to do when we eval them. We can look at all different facets of it and come up with an individualized treatment plan. Kind of like this last thing here before we get to questions and stuff is shoe advice for toe walkers. So a lot of people think, oh, if I put them in boots, it'll get their heel down. It's really, really heavy. Nope, it's just going to hide the fact that they're walking on their toes, because the boots are loose and heavy. So the heel of the boot might get down, but their heel probably doesn't. They also probably like boots better because it's easier for them to walk the way that they want to walk in them. Flip-flops are not great either. They provide stability for nobody. And if you think you're walking on your toes all the time, those things can fold over and get caught on stuff. What we would ideally like is a structured shoe where you can kind of see in this picture, the toe kind of curves up. So you're already putting the foot, instead of in this position, more of in this position where you're trying to push the heel down to get that toe contact. I mean, it's not going to work on its own. It's just kind of the ideal shoe that we would like to see them in. So if you are concerned about your child's toe walking, you can request a PT evaluation at bpnht.com evaluation, or you can call this number here. What we really want you guys to get out of today is the information, knowing some of the signs and kind of some of the paths that we go down. Like Becky mentioned earlier, just because they come in for an evaluation, sometimes PT intervention isn't warranted. I'd be more than happy to have you come in with your kiddo because you think they're toe walking, and I'd be happy to tell you that they're not and send them on their way. But this is just a resource for you to have, that if you're questioning it, or if you notice some things about your kid may not be what you think is typical, come in for a PT evaluation. So thank you. I think we're at the point now, if anybody has any questions, you're more than welcome to turn on your video and ask, or you can put a question in the chat. It was a pretty short presentation, so kind of up to you guys. From here, we're happy to answer anybody's questions.
Thank you. Thank you. Can you touch on, you said that during an evaluation, you'll come up with an individualized treatment plan, which is different for every child, but what can a parent or guardian expect as far as duration of treatment for something like toe walking?
Really depends. It depends on the kiddo and the reasons why they're toe walking. I mean, I can't give you a solid answer on that, sorry.
So it varies.
Yeah.
It varies from what, weeks to months, perhaps?
I've seen kids for 3 months. I've seen them for a couple years.
Okay.
But usually the longer durations are kids that have never had treatment and it was way later in life. So there's lots of tightness, and there's a sensory component, and there's more and more things to address, and they're tougher to quote unquote fix.
Yes.
Because it's just been a learned motor pattern with other impairments.
Yes.
Bree asked, is it possible to develop toe walking after they initially learn to walk? Yes, totally. Like we said, there's a bunch of causes to what toe walking is, so it doesn't necessarily happen right when they learn to walk. We're talking about toe walking is anytime for prolonged periods of time where they start to develop this toe-to-toe pattern, but it doesn't always happen right when they start walking. It can happen at any time.
Thank you. If anybody else has questions, please feel free to put it in the chat. Okay, do you see that one from Amy there? Do you want to read that, Megan?
Yes. So I've been told in the past that my son's toe walking is behavioral and that PT is not warranted. We haven't been able to get him an eval in the past, but could now. Are you able to determine if PT is warranted, and how do you do that? He's 7 and has autism spectrum disorder. You want to take that, Becky, or do you want me to answer it?
Yeah, so that is definitely warranted to come in, like we were saying, come in, have us evaluate and see what's going on. Even if it's behavioral, like that doctor is saying, it's probably now a learned pattern, and it's something to be treated and to look into to whether or not it really is behavioral, or if there's really tightness now, or is it a sensory origin? Just like we were saying, we should address it. No adult should be walking on their toes.
Yeah.
We don't want them walking on their toes regardless. We have great success with treating it, so definitely have them come in.
And it's kind of hard to explain how we determine if it's behavioral or not. Like we said, it's a pretty comprehensive eval, but if we can feel the tightness and if we can see that they're walking on their toes all the time or during different sensory stimulations or in response to different activities, I mean, it all kind of paints a picture for us. So we're definitely able to tell you that in particular, but like Becky said, if they're 7 and they're still toe walking for a while, it'd be best to bring them in.
And then you would be able to determine if PT is the right solution for them, or if they would need to go to another specialist or an occupational therapist as well, which we also have on our team, correct?
Yes.
And one of the benefits of what we do is that our therapists, because we have a team of speech, occupational, and physical therapists, they're able to work collaboratively on patient cases. So sometimes a child will come for one discipline, but might be seen also for speech or also for OT. And so our therapists, the way we're structured, we work very collaboratively so that we can work towards creating functional independence for that child and success for that child in meeting all the facets of their goals in those different disciplines, so that they will have a stronger foundation as they grow.
And our goal is not to keep your child in therapy forever. Like we said earlier, I mean, we really want the kid to be able to participate to life and to the fullest of their ability. So we want to get them in and we want to treat them, but we ideally want them to go off on their own and not have to need therapy. So we're not trying to keep them forever. Brooke said, my 7-year-old daughter recently has started walking on her toes, wondering if it could be stress related. She did it short term at 3 years old, but stopped. Could you elaborate on how recently she's been walking on her toes? Yes.
You mean how long it has been going on?
Yeah. Since early summer in June.
June. So that's 5-6 months.
I would say mostly there are kids that toe walk at first, then they stop, and then it comes back, just like sometimes they might be weak when they're 4, they get strong, but then they don't progress again, so they can't do their gross motor milestones at 8 because they didn't progress even more. Definitely something to come in, have us take a look at it, so that we can actually give you sound advice by seeing your kid, so we can tell you if this is just a short time thing or if this is something that needs to get addressed.
Usually if it's prolonged like that, even if it could be stress related, it's now kind of a pattern because it's been going on for a certain period of time. So like if you had said, oh, it was only like a week ago and she's kind of back down, then it'd be like, yeah, maybe she had a stressful week. But yeah, since it's been since the summer, it would be good to bring her in.
And just to let everyone know, we do take most of the major insurances. And you're welcome, thank you. And if you need a referral, if you want to get an evaluation, go ahead and request that, and we can help you obtain the referral from your primary care physician. So it's not something you have to go out and seek on your own. That's something that we'd be happy to facilitate in our process for you. So if anyone else has another question, go ahead and put that in the chat. I also want to let you know this is being recorded, and we will send the recording out to you. It will be available for 2 weeks after the event, so that if you want to rewatch it or share it with friends and family, we're happy to do that. Yes, this person is asking, with COVID, are evaluations in person or on Zoom? Do you want to talk about that?
Sure. They're in person. We follow every safety precaution. We only have a certain amount of people in the clinic at a time. We have sections of where kids and their therapists are allowed to go. Everybody wears a mask. We have some amazing aides that clean everything between every kid. And we hand sanitize between every kid. So they are in person because we think that you get the full value of the eval through it, because it's kind of hard to see things and get kids to do things through Zoom. But we're taking every precaution that we can.
Yes, and then the treatment is available in person or via telehealth. It generally varies per the patient's needs, but we do offer in-person and telehealth sessions. So go ahead and put additional questions in the chat, Becky and or Megan. Okay, there's another question. Do you see that, Megan?
Yeah, my 22-month-old son has started walking on his toes very often over the last 3 weeks. Should I just keep an eye on it for the next 5 months? If it goes away before then, just assume it's just experimenting with his body. I like the way that you put that.
When did they start walking independently? If it's been past 6 months of walking independently, which likely they have been, and it's just 3 weeks, I'd watch it just for a little bit longer, just a couple weeks, and then maybe come on in if it's continuing.
He was about a year.
Okay. Yeah, like she said, I think you don't have to necessarily do it for the next 5 months, but if it continues on and like it's a month and it's kind of 2 months and you're not really seeing it go down and you're seeing it more often, like we said, the earlier we can get them in, the better. We just kind of define it by that 6-month period. But if you feel like it's developing a pattern, we're more than happy to see them. And we might tell you don't need it, but you can always come in.
Yes, it's always good to determine if they need further support or if that can be ruled out. You're welcome. Thank you. So Becky and Megan, again, if anybody has another question, feel free to put it in the chat. But Becky and Megan, can you touch on what are some of the other conditions that our PTs treat?
Oh.
All right. Well, we actually, one big surprise for a lot of people is we start treating people from birth. They're PTs in the NICU, they're PTs in the hospital, and the youngest kiddo I've treated is 1 month old with torticollis or a diagnosis of Down syndrome or some genetic condition or neurological condition where it's inhibiting them to have head control. Or they're really weak core, not able to roll, crawl, or walk. So just some of those early milestones from the first year. Some kids with other diagnoses we're treating early on. Some of the main things would be the torticollis, where your head is kind of tilted one way, is a big one for those young kiddos, and those gross motor delays for the younger kiddos. Megan, do you want to touch on the older kiddo diagnoses that are more common?
I mean, we kind of treat like a whole bunch of diagnoses, cerebral palsy, just global delay. So really the way that I like to think about it is we as pediatric PTs treat the way that kids move and how they get from place to place and get to participate in activities. And so if you notice that your kiddo is just not where you think they should be for their age, or not being able to do the things that you think that they should be able to do, we can help. So we could treat an ankle sprain, we could treat neck pain, we can treat juvenile arthritis. We kind of treat like a whole spectrum, and it doesn't necessarily need a specific diagnosis, although we get those a lot too. But a lot of times we just get a diagnosis of like other reason for poor balance, which is a diagnostic code apparently. So really we treat a lot and everything, like she said, from birth to up to age 21, and anytime that it's just their ability to move or participate in the world around them, we're happy to help. If it's pain, if it's motion related, if it's balance, that's kind of our wheelhouse. Does anybody else have any questions for us? We're happy to answer any of them or any feedback.
Okay, well, thank you everyone for attending tonight. It was our pleasure providing this information for you. And if you do have any questions, you can go ahead and email them. You can email them to me and I'll make sure that we get them answered with Becky and Megan. I'm Diana, Diana, initial K at bpht.com. And it was our pleasure having you here tonight. Thank you so much for attending, and we hope you got some value out of this. Take care, everyone.